Have you ever wondered why that hard yellow buildup keeps coming back on the same teeth? No matter how carefully you brush, you scrub your teeth every morning. You floss when you remember. You spend money on expensive toothpaste. Yet somehow, just a few months after a professional cleaning, that stubborn tartar is back again, almost in the exact same place. What if I told you that it has very little to do with how hard you brush? And what if the real reason has been hiding inside your mouth all along? Most people believe tartar is nothing more than a cosmetic issue, something that simply makes your teeth look dirty. But the truth is far more surprising, and potentially far more serious. Because tartar doesn't just sit on the surface of your teeth, it creates the perfect environment for harmful bacteria to thrive. As this hardened buildup grows along the gum line, it can irritate the delicate gum tissue, causing inflammation, swelling, tenderness, and bleeding. Many people notice blood when brushing their teeth and assume they are brushing too hard. In reality, bleeding gums are often a warning sign that bacteria have already begun irritating the tissue beneath the surface. And here's where things become even more concerning. Your gums are filled with thousands of tiny blood vessels. When inflammation weakens this protective barrier, harmful bacteria from your mouth may gain access to your bloodstream. Scientists have spent years studying this connection, and they have discovered something that surprised even many healthcare professionals. Researchers have identified oral bacteria in places far beyond the mouth, including areas affected by serious health conditions. While this does not prove that tartar directly causes these diseases, it does show that your oral health may have a much greater impact on your overall health than most people realize. That is why dentists constantly remind patients not to ignore bleeding gums or heavy tartar buildup. Your mouth isn't isolated from the rest of your body. It's one of the main gateways into it. But here's the question almost nobody asks. If millions of people brush their teeth every single day, why do some people barely develop any tartar at all, while others seem to get it back again and again, even after regular dental cleanings? Is it because they don't brush properly? Is it because they eat too much calcium? Or is there a completely different reason that almost nobody is talking about? The answer may completely change the way you think about dental health, because tartar isn't simply leftover food stuck to your teeth. It follows a very specific process inside your mouth, and once you understand how that process works, preventing tartar becomes much easier than most people imagine. In the next few minutes, you're going to discover why tartar almost always appears in the same location, why brushing alone often isn't enough to stop it, and the hidden mistake that allows it to return over and over again. And before we move on, take a quick look at the inside of your lower front teeth. If you can feel a rough surface with your tongue, or you've noticed yellow or brown deposits that never seem to disappear, stay with me until the end. Because the next part reveals the hidden cause of tartar that many people never hear about. And once you understand it, you'll finally know why this problem keeps coming back. Now that you know tartar is more than just a cosmetic problem, let's talk about the hidden reason why it keeps coming back again and again. Most people think tartar happens because they are not brushing enough, or because they are eating too much calcium. But that's not the real reason. Before tartar forms, there is something called plaque. Plaque is a soft, sticky layer filled with bacteria that constantly builds up on your teeth. When this plaque is not removed properly, minerals from your saliva begin attaching to it and slowly turn it into a hard, cement-like substance called tartar. And here's the part most people don't know. Once tartar becomes hardened, your toothbrush cannot simply brush it away. No matter how hard you scrub, that buildup has already changed. It has become attached to your teeth, which is why professional dental cleaning is usually needed to remove it. But why does tartar always seem to appear in the same areas, especially behind the lower front teeth? The answer is your saliva. There are small salivary glands located underneath your jaw that release saliva through tiny openings near those teeth. This saliva contains minerals like calcium and phosphate that help protect your teeth. But for some people, these minerals also make it easier for plaque to harden into tartar. This is why two people can have completely different experiences. One person may rarely get tartar, while another person can develop buildup even with regular brushing. The difference is not always their effort. It can be their saliva, their oral bacteria, their daily habits, and the environment inside their mouth. And this leads to the biggest question. If tartar formation starts this quickly, what can you actually do every day to stop it before it becomes a problem? Because the key is not removing tartar after it forms. The key is stopping the process before plaque has the chance to become hard. And in the next part, we will reveal the everyday mistakes that allow tartar to return faster and the simple habits that can help keep your teeth cleaner for much longer. Now that you understand why tartar keeps coming back, let's talk about what you can actually do to stop it before it starts. The biggest mistake people make is trying to remove tartar after it has already become hard. The real secret is preventing plaque from getting the chance to turn into tartar in the first place. Start with the basics. Brush your teeth twice a day, especially before going to sleep. Nighttime is one of the most important moments because bacteria can multiply while you are resting. But don't just brush the teeth you can see. Pay special attention to the areas near your gum line and behind your lower front teeth, because these are common places where tartar begins to form. The second important habit is cleaning between your teeth. Your toothbrush cannot reach every small space, and hidden plaque between teeth can slowly harden over time. Using floss or another method that cleans between your teeth can help remove buildup before it becomes a bigger problem. Another thing to remember is that your mouth environment matters. Reducing frequent sugar intake, maintaining good hydration, and supporting a healthy oral routine can help create an environment where harmful bacteria have a harder time taking over. Some people also use ingredients like baking soda or xylitol as part of their oral care routine, but the most important factor is consistency. A perfect product will not replace daily habits. And remember this, your teeth are not separate from your body. Your mouth is connected to your overall health, and taking care of your gums and teeth is one of the simplest ways to protect yourself for the future. So the next time you notice tartar forming, don't just ask, "How do I remove it?" Ask a better question. How do I stop it from forming again? Because prevention will always be easier than fighting a problem after it has already started. If you found this information helpful, share this video with someone who struggles with tartar buildup, and subscribe for more simple health information that can help you take better care of your body.